Okay, so the COVID-19 pandemic has now caused more than 1 million cases globally and claimed tens of thousands of lives. The high rate of spread due to the unavailability of a COVID-19 vaccine makes prevention the best way to avoid contracting this zoonotic disease. There are some basic things you can do to reduce the risk of transmitting the disease caused by SARS-CoV-2. The increasing number of cases and fatalities has made people around the world, including Indonesia, very alert to the development of the COVID-19 outbreak. There are several ways to prevent COVID-19 disease so as not to contract the virus, namely the first, wash hands with soap and water. One way to prevent COVID-19 is to wash your hands properly. Washing hands is a healthy habit that looks simple, but it is effective in reducing the risk of transmitting viral infection. This is because human hands are filled with various kinds of bacteria and virus, especially when a crowded place. Dispersed pathogens can stick to your hands and put you at a greater risk of transmitting viral infection such as SARS-CoV-2. Disease can also be transmitted when you touch items that have been splashed with bodily fluids of people who have the virus. After touching the item, you may unknowingly touch your eyes, nose, and mouth with unwashed hands. When traveling, you should always have a hand sanitizer with an alcohol content between 60 or 95% to kill germs effectively. You can choose a hand sanitizer that contains aloe vera to keep your hands soft. If you have sensitive skin, the allergen-free fragrance is perfect for giving extra softness to the skin and keep your hand clean. Secondly, reduce contact with sick people. In addition to washing hands, another way to prevent COVID-19 is to reduce contact with people who are sick or who have coughs, fever, and sneeze. This method is highly recommended considering that COVID-19 transmission occurs through droplets, which are splashes of body fluids when a patient coughs, sneezes, or talks. In addition, when you feel unwell, try to stay at home and wear a mask if you have to come to contact with other people. Choose the right mask and according to your needs. That way, you don't transmit viral infection to other people and don't catch disease when your body is not healthy. The third, practice cough etiquette and wear a mask when sick. Many people think that wearing a mask, even if you are in good health, is an effective way to prevent COVID-19. In fact, it is not so. The use of masks is more effective for sick people and health workers who often come into contact with infected patients. Health workers are the people most at risk of contracting, so they need extra protection. In addition, the use of masks will be more effective when combined with the habit of washing hands regularly. If you are sick and there is no mask available, You can prevent the transmission of COVID-19 by applying cold etiquette. The trick is to cover your mouth when you cough or sneeze with a tissue or use your arm. The 4. Implement social distancing. The results of the investigation found that COVID-19 can be transmitted without symptoms. This means that even people who appear healthy will not even know they have COVID-19. He can transmit the virus just by being in a crowd. This is why social distancing is so important. Social distancing is an effort to keep a distance from other people and avoid crowding activities to break the chain of spreading disease. A number of countries have also implemented lockdowns or restrictions on entry and exit access in their territory. Although not implementing a lockdown, Indonesia is implementing large-scale social restriction or PSBB with almost similar principles. Restriction of contact, but with social distancing, lockdown, and PSBB is currently the best way to inhibit disease transmission. You can take part by applying to the contact restriction the rules that apply in the area where you live. COVID-19 is an infectious disease with a high transmission rate. Like other diseases caused by the coronavirus, COVID-19 also needs to be prevented by implementing clean living behaviors, maintaining body immunity, and limiting contact with other people. In order, in order to complete the above efforts, don't forget to update with the latest information related to COVID-19, starting from the number of cases, treatment methods, recommendation when traveling abroad, and following advice from official health service. In an effort to stop the spread of COVID-19, the public is asked to self-quarantine and implement social distancing. However, pregnant women are one of the groups that are constrained in this regard, especially because they need to carry out routine prenatal checkups during the COVID-19 pandemic. And then the fifth, maintenance endurance. Actually, the thing that needs to be considered as one way to prevent COVID-19 is to maintain the immune system. If your immune system is low, especially when you are sick, it is easier for virus to attack the body, whether it is the flu virus or SARS-CoV-2. However, there are many habits of Indonesian people that make the body lack vitamins and minerals. The most common habit found, for example, are many people who are lazy to do outdoor activity. These habits make the body less exposed to sunlight, which is the main source of vitamin D. Lack of vitamin D actually makes the immune response to attack virus and bacteria decrease. Therefore, the body becomes more susceptible to viral infection and disease. Not only are you at risk for COVID-19, but allow immune system also cause symptoms get worse. Therefore, maintaining to the immune system is very important as a way to prevent COVID-19. But fulfilling Then for fully intake and basking in the sun every morning for 30 minutes.